respiratory systems, respiratory viruses, there's just so much to say and so much that we learned over the last year. There's quite a few. And one virus that really bothers me the most is called tobacco, and that's something we need to avoid. But there's just kidding about being a virus, but it does a lot of deadly things. And we're going to talk about what gets into your lungs, viruses and bacteria. Let's hear more.
Awesome. Thank you, Dr. Curnew. So we'll first begin with talking about different types of respiratory infections, beginning with influenza. So influenza is also known as the flu, and it's an infection of the nose, throat, and the lungs. So basically all your respiratory sites, and it's caused by the influenza virus. Common symptoms include things like fever, although it's not present in everyone, as well as aching muscles, chills and sweats, headaches, dry, persistent cough, shortness of breath, tiredness and weakness, running or congested nose, sore throat, and eye pain. And it does develop faster than a common cold, which does happen to develop a little more slowly. So although the flu is something that we get commonly, it's not as often discussed as something that is life-threatening. It can cause complications in certain individuals, and this group of people includes those who are 65 years and older, children younger than 2 years old, pregnant mothers, children with neurological conditions, racial and ethnic minority groups, people with asthma, heart disease, and stroke, diabetes, HIV or AIDS, cancer, chronic kidney disease, and disabilities.
So if you
But
just go ahead, keep talking.
Okay, but I'll focus on three of these risk factors that I think might be the most applicable to our viewers here today and also the patients at our clinic. So the first includes seniors or those who are 65 years and older. So with age, our body naturally have changes in our immune system, and although you can, boost your immune system by things like exercise and losing weight, we'll talk more about that later in our presentation. But about 70 to 85% of seasonal flu-related deaths occur in this age group, as well about 50 to 70% of seasonal flu-related hospitalizations occur in this age group. For people with heart disease and stroke, in a study found that among those who were hospitalized with flu during recent flu seasons, heart disease was one of the most common chronic conditions. And a 2018 study showed that a risk of having a heart attack within the first week of having a confirmed flu infection was 6 times higher. Another study 2 years ago in 2020 found that serious heart complications occurred in about 1 in 8 adults hospitalized with the flu. And in terms of people with diabetes, even if your diabetes is well managed, you are still at a higher risk of developing flu complications. In recent flu seasons, about 30% of adults hospitalized with the flu had diabetes, according to the CDC. Flu can also make controlling your blood sugar more difficult as your appetite for food decreases or changes, and activity levels also change. It's also important to follow the sick day guidelines provided by your care provider when you do come down with the flu.
Actually, just go back one slide there. So interesting. So respiratory viruses, you breathe them in, and so they're airborne, and they get into your lungs, and they can cause damage. And the flu is characteristically a killing disease in the winter months. You can see some of the risk factors here. They're very young, they're very old. Pregnancy, your immune system is weakened. Other things to mention is that people with underlying lung disease, smokers. So smokers have damaged lungs, and they get flu. They get sicker as well. If your immune system is suppressed, let's say you're on chemotherapy for cancer, you have rheumatological disorders that you're on immune suppressants to suppress your arthritis. They can always cause damage. So the flu can be mild, but it also can be quite a profound illness and fatal. So right now is that the flu is now becoming a big problem in Ontario and across Canada. The numbers are skyrocketing, and the best time to get your flu shot is today. And we'll talk about that a little bit later. And we can argue what flu shot to get. I'll argue it's like going fishing. Get your lure in the waters. You can't catch fish if you don't have any bait and lures on there. And any flu shot is a good shot. And we can always talk about the senior shot, which gives you a higher antigen load to help protect you. So just take a look and see if you fit there. So who should get vaccinated for influenza? Basically everybody, in my mind, should get vaccinated. Next slide, please. And again, the high-risk groups, as we talk about, is that the best thing to do is don't get older. Your immune system peaks in your 20s. Afterwards, it's all downhill. And once you're at 50, then 60, 65, your immune system really starts to fail. And thank you so much for letting us about that. And unfortunately, people who have heart disease, stroke, diabetes, lung disease are all at high risk for complications from any infectious process involving the lungs. Thank you for sharing that. Tell us more.
No problem. So now we'll talk about like when to see a doctor. So most flus are self-resolving and that they will get better on their own with time. However, if you are at a higher risk of flu complications, it might be important to contact your family doctor or your primary care physician. You can also look out for emergency symptoms like difficulty breathing, shortness of breath, chest pains, ongoing seizures, worsening of current medical conditions, and severe weakness or muscle pain. Now we'll talk about flu vaccines. So what can we
just backtrack a little more slide. This is actually important. If you think you have any respiratory illness, what I've learned is that we have to protect yourself and protect others. If you're sick, you need to seek medical help. If you're not that sick, you need to isolate yourself so you don't get other people sick. And the worst thing you can do is bring this in to somebody else who has a weaker immune system than yourself, and they can get very sick and actually die from this. Tell us more about the vaccines and the choices of therapy.
Yeah, for sure. So flu vaccine is the best protection against a flu. Recent studies have shown that flu vaccines reduce the risk of flu by around 40 to 60% in the general population during flu seasons. During the last flu season before the pandemic, about 7.5 million flu illnesses, 3.7 million flu-associated medical visits, and up around 100,000 flu-associated hospitalizations and 6,000 flu-associated deaths were reported. A common misconception about flu vaccines is that it will protect you 100% from catching the illness. However, like all other vaccines, you can still have breakthrough infections, but it will reduce the severity and the likelihood of you catching it. A study showed that vaccinated adults hospitalized with the flu had 26% lower risk of ICU admissions and 31% lower risk of death from the flu than those who were unvaccinated. Additionally, other benefits of flu vaccinations include lower rates of major adverse cardiovascular events and lower risk of chronic lung disease like COPD.
So that's actually important to remind ourselves, is that you get the flu shot to decrease the severity of your illness and mostly fatal complications. So it's actually very important. In fact, there is randomized data that took 3 flu seasons, took patients that were admitted to hospital. Because you mentioned that people who have higher complications from the flu are people who have heart disease. So they took patients that were hospitalized, having a heart attack or having an angioplasty, and they were randomized in 3 consecutive flu seasons to the flu vaccine or a fake vaccine. And it showed that you actually decreased cardiovascular events by about 25%, and you decrease mortality by over 40%. So remember, the flu influenza damages your vessels, damages your heart, and makes you more susceptible to heart attacks. And so it's really important to think about that. And it's actually been shown is that right now, if you come to the hospital with a heart attack or an angioplasty in the hospital, the best one of the strategies to prevent you from having a heart attack or another heart attack is to get vaccinated. And some years the flus are bad, some years the flu season is more mild, and the vaccines adapt to it every year. This year looks like it's going to be a bad year. We're up to conversion rates of people who can test up to over 10%. So that means it's coming earlier and harder. As you know, hospitals are already overwhelmed right now, and the flu's just starting. So, so the best way to not get hospitalized from influenza is to be vaccinated, and obviously to avoid people that are sick. So if you're sick, isolate yourself, don't spread to others, and wear appropriate masking devices, as we'll talk about in a little bit. Good hygiene. But this is really a something it's important. I hear so many people say, "Well, I never took the flu shot. I want natural immunity." I would rather have protection, because influenza will damage your insides and it will damage blood vessels in your heart, and that may make you more prone to heart disease later on afterwards as well. So I got my flu shot. I hope you get yours real soon.
Okay. And now we'll move on to COVID-19. So hopefully by now we are all familiar with what it is. So it's a disease caused by a virus called the SARS-CoV-2 virus. It was first discovered in Wuhan, China in December 2019. And then on March 11th, 2020, it was the WHO declared COVID-19 a global pandemic. And the map here on the screen just shows the global cumulative cases of COVID-19 reported per 100,000 population. So what we know, this one was about the flu. I think it just got moved around a bit. But like Dr. Curnew was saying, this year's flu season is looking a lot worse compared to past years. One of the reasons could be attributed to the fact that more people are testing and for the flu just to see if they have COVID. But you can also this is like the US population, but if you look at the headlines, even within Canada right now, a lot of hospitals are being strained. And healthcare workers, I believe, are also like reducing optional surgeries as well currently in lots of hospitals, just because the flu season this year is quite steep compared to previous years. Going back to COVID, so what we know so far. There have been a wide range of symptoms reported so far, and symptoms can appear around 2 to 14 days after exposure to the virus. And it's also possible to have what's called long COVID. We'll get into this in the next slide, but those who are at a higher risk of COVID-19 complications include older adults with underlying health conditions, and COVID-19 vaccines are safe and effective. So far, there's been around 635 million cases and around 6 million deaths. So what is long COVID? So this is when some people experience long-term changes due to the disease. It can last anywhere from weeks to a month or even longer. And it's more common in those who experience severe COVID-19. And those not vaccinated are also more likely to develop long COVID as well. But it can develop or present itself differently among different people. And
So it's quite interesting. If you go back to COVID itself, is that about 50% of people who get COVID are totally asymptomatic at this stage. And right, the more sick you are, the more likely you have to have more prolonged symptoms such as long COVID. But you can be totally asymptomatic and develop long COVID later. So tell us a little bit more about it.
Yeah, so here's just some like long COVID symptoms that you could look out for, such as fatigue, worsening of symptoms after physical or mental exertion, fever, shortness of breath, cough, chest pain. So normally if it lasts longer than so if you're getting these symptoms after I'd say like around 2 weeks of getting the infection, then you can pretty much just call it long COVID. It may go away within a couple of weeks, but again, it could last up to a month or even longer.
Well, actually, long COVID is usually longer. It's usually 3 to 6 months after exposure, and people are quite persistent. I've seen, unfortunately, too many cases. In one study, for instance, if you just backtrack one slide, is that 10% of patients who were vaccinated got long COVID, and 15% of patients who were unvaccinated got long COVID. So we believe that you cut the risk in half by being vaccinated, and it can be quite disabling. Is that these were people, high functioning people. Yes, it can cause a heart attack. Yes, it can cause blood clots. Yes, it can cause stroke. Yes, it can cause dementia. Yes, it can cause atrial fibrillation. But it can also cause the symptoms of terrible fatigue and just can't even get through the day properly. You have to rest. You have a fogginess to your memory, and you're just non-functional, and it can be really devastating. So it can be different presentations. We're still learning about this. Is that there is microclots COVID cause. Some people believe that the virus is dormant or remains in parts of the body. Also triggers the immune system, so causes immune reaction. It can actually damage your immune system. So other viruses like CMV, other viruses in your system that normally don't cause a problem become problematic and cause issues. We have a lot to learn about this, from inflammation, how to affect the immune system, and what to go on right now. So we have a lot to learn right now, but it's rolling the dice, and the best way to not get COVID or long COVID is not to get COVID at all. And the next thing to do, if you do get COVID, it's better to be vaccinated and protected as best you can. Yes, there's complications from the vaccine, but the complications of vaccine are quite mild compared to what COVID can do. Tell us more.
Yeah, so we can talk about like COVID-19 versus influenza, how they might be similar and how they might be different. So there are some similarities, like how it spreads. For For example, they both spread between people who are in close contact via respiratory droplets or aerosols. They are also similar in terms of symptoms like fever, cough, shortness of breath, fatigue, sore throat, etc. They can lead to similar complications as well, such as pneumonia. But some differences include things like how they are caused by different viruses. So COVID-19 is caused by, again, SARS-CoV-2, and influenza is caused by influenza virus A and B. Onset of symptoms is also different. So COVID symptoms usually appear around 2 to 14 days after exposure to the virus, versus with the flu, it usually appears 1 to 4 days after exposure. COVID-19 is also more contagious and spreads more quickly. You may also lose taste or smell, which is not very common with the flu. Severe illness is also more common with COVID as well, and COVID can lead to long COVID, multisystem inflammatory syndrome in children, and other complications that are not very common in flu. But flu can lead to secondary bacterial infections more often than COVID-19 infections. Treatments also differ in that while flu is treated with 3 different antiviral drugs, the only one antiviral drug currently approved for COVID-19 is remdesivir. I'll talk about some risk factors as well for complications. So similar to the flu, you may be at a higher risk for COVID-19 infection-related complications if you're an older adult, have a weakened immune system, or have underlying health conditions. Currently, this is
If you go backtrack, so these are the health conditions that just being overweight. So when COVID made its appearance, I spent a lot of time losing weight and getting my body mass index down to less than 25. So we know any body mass index north of 24 increases complications, because overweight is an inflammatory disease and makes your body inflammation system work harder. So getting that weight down is a really good thing to think. There's nothing good about smoking. Having diabetes is, loses 10 to 15 years of life, high clotting problems, cardiovascular disease we talked about, and just having high blood pressure, because what is it that COVID goes through something called the AT1 receptor. That's a receptor that we sometimes use to treat blood pressure. We block that receptor, and so these are receptors that line your blood vessels. So lines that goes into your heart, goes into your kidneys. So it just damages. And yes, you may get better, but what the biggest concern is, what's going to happen if we get COVID 1, 2, 3, 5, 10 times over a lifetime? Because COVID is not going away. The disease is changing, and we're going to have to change with it. So these are the people at highest risk, but I don't think it's ever good to get sick, even if it's asymptomatic disease. It reminds me of that movie called Concussion. Remember all those football players that had early type of Alzheimer's-like presentations or dementing illnesses because they had multiple concussions over their lifetime playing football. I worry about COVID causing concussions to your vasculature, to your blood vessels, to your heart, to your kidneys. We know that there's more diabetes, there's more blood clots, there's more heart damage, there's more strokes, shrinks your brain. I need all the brain cells I have left. So just sort of think about how to protect yourself. And these are some of the complications. So thank you for sharing that. Tell us more.
Yeah, so I'll talk about what the current statistics say about COVID-19. So although it may seem like COVID-19 infections are less common compared to April 2020, there's actually more infections happening right now. There's just, I guess, less or comparable number of people in the ICU. In Ontario, COVID-19 infections are currently on a decline wave, whereas the flu infections are currently rising. But again, this could be due to confounders such as more people getting tested for the flu as well.
It's
Now,
also that COVID actually changed. COVID was a much more fatal disease. Now the disease has changed. The disease has mutated. You mentioned the flu. The flu mutates as well. Some years we have a bad flu infection. Sometimes we have a less so form. So viruses, by definition, have to use a host, and they basically go over your own machinery to reproduce itself. And sometimes they cause a lot more damage certain years than other years, and sometimes your body can fight it, and sometimes we can't. It's interesting when the year of COVID, the first year, is that there was no flu because people were isolated, people were kept away from each other, so that prevented it from happening. Also, this year we have a stronger version of influenza, and so we're going to pay a price certain years, and this is going to be one year. It looks like it's going to be a bad year, but only time will tell.
Yes, and now we'll discuss COVID-19 vaccines. So again, just to clarify, COVID-19 vaccines are safe and effective. But we do begin to lose immunity about 3 to 6 months after vaccinations. There are no preservatives, antibiotics, tissues, food proteins, metals, or latex in the vaccines. And here on the screen, you can read some of the available vaccines. A lot of them you may have already heard of, like Pfizer and Moderna. Recently, there are also bivalent vaccines that are available. So these are vaccines based on the original strain, as well as the recent Omicron strain. It's recommended that those who are under 65 get a booster shot every 6 months or after 6 months after getting an infection. But if you're over 65, we recommend you speak to your family, your doctor, to best manage your risk and your health against COVID-19.
So that's actually really important. Thank you for sharing that. So basically, what happens is you start to lose protection around 3 to 6 months. And we know the highest risk people are, as you get older, people with cardiovascular disease, diabetes, etc. We talked about. There's three reasons to be vaccinated. One is to protect yourself, one is to protect others, and third is so the disease mutate less. Those three things still take place. At the start of COVID, we were hoping that we can get herd immunity if 80% of us were vaccinated. However, the disease has mutated, and your body develops that it can't keep the neutralizing antibodies to the highest level that's necessary. We can decrease severity of disease, we can decrease amount of mutations, and we can also protect others. So my recommendation for almost everybody is that I would get a vaccine every 6 months at this stage, and we'll have more information as time goes on. If you get COVID, to me that counts as a vaccine. You get protection. Even those who get COVID will lose protection, and so I count getting COVID as being vaccinated, and I count getting vaccinated as being vaccinated. So every 6 months right now is my current recommendation based on a lot of smart people, and that information will change, and we'll change with that. Now, some high-risk people that have cancer, immune suppression, they may need it more often, such as 3 months and things of that nature as well. That's an individual decision. But for the average North American, getting a vaccine every 6 months or waiting 6 months after a COVID infection is very reasonable at this stage. But we're still learning more, and stay tuned. So if you want to talk about it, talk to your doctors about that. And one of the things is that I find this field complicated, hard to understand. I don't imagine, and I spend a lot of time thinking, talking, and be exposed to real experts around this. So let me share what we know and find healthcare providers that you trust, and talk to them.
For sure. So that's everything that we have for COVID-19. But there are more. Oh, actually, no. There are some myths about COVID vaccines that we also want to go over. So things like the COVID vaccine can give me like the disease itself. No, that's not true. mRNA vaccines cannot infect you. Viral vector vaccines also cannot infect you. And the COVID-19 vaccines that we currently have are only to provide our body with the trigger for antibody production alone. The mRNA cannot do anything. Another myth was that the vaccine was developed with insufficient research. That's also untrue. The SARS-CoV-2 is not the first coronavirus that we have experience with. There are decades of research on the coronavirus family, and the mRNA vaccine platforms were being conceptualized before COVID as well. If I get both vaccines, I don't need to follow protocols. So the vaccines do reduce hospitalizations by 90%, but they do not stop you from getting the disease itself. You can still catch COVID-19 if you're vaccinated, so you should still continue to follow safety protocols and mask, or you're encouraged to mask.
I don't think anybody will ever say that you can't have complications. So from the vaccine, we know a lot more. You get a lot more complications by COVID than the vaccine. So first of all, the vaccine doesn't alter your DNA. The mRNA technology, what it does do is it allows the spike protein, which is part of COVID, to enter your body, and your body to recognize it, and then to develop antibodies, defense against that. And you want to develop something called neutralizing antibodies. And so they're able to find a way of doing this. And that's remarkable technology. people say the vaccine hasn't been studied. In fact, it's the most studied vaccine ever done because of just the magnitude of people. All the trials were done simultaneously. They didn't do it sequentially. So I'm just totally amazed as that what's being attributed to success right now. How many people again have died from COVID at this point in time, Sue Ben? What's the estimation?
I think it was around 6 million.
Okay, and so that's a lot of people have died already. It would have been probably a lot worse. Um, and I'm glad the disease is not as strong as it was before. Now we'll have to see but the long COVID syndrome is a real entity. What recurrent infections will do, we won't know yet, but it's not going to be a good thing. So keep your guard up. Lots of ways to keep guard one of these things. And we'll talk about, which ones to get. Isolation, proper care, and one of the things I have to give credit to Big Pharma. As much as the pharmaceutical industry is a very powerful industry, they actually probably save millions of lives, and I have to thank them for that. And we have to move forward. Mind you, I'm also worried about the price we're paying for all our medications, and so we have to find that balance between innovation, good care, and cost. So that's something we have to look at that right now. But this has been a great breakthrough. Vaccines in general, I've learned so much about vaccines in general, and one of the things is making a good diagnosis, being a good clinician is a wonderful thing. Preventing disease is even a better thing, and this or getting the severity of disease is also a wonderful thing too as well. We can't make vaccines against every disease. HIV is a prime example about this. We cannot develop neutralizing antibodies in that disease process. You can see like polio is a disease of the past, as long as you're properly vaccinated and there's no polio, and smallpox was eliminated from, or at least we believe it's eliminated. I hope it doesn't come back. So that's thanks to vaccination. So, and this vaccine technology has developed over decades, and it's just truly amazing what can be achieved. So the vaccines today are due to the technology of yesterday. It's like the car. The Model Ford was, the first big car. Now, I hope everybody gets an electric car one day, and that's based on cars from the past. Yeah, keep talking. Keep telling us more.
Okay, just to bust some more myths, as we already discussed, if you have COVID, I don't need to get the vaccine. So getting COVID will still boost your immune system, but again, that will only last around 3 to 6 months until you have to get your next vaccine again. Side effects from the vaccines are serious. So common side effects include fatigue, headaches, sore arm, and low-grade fever. Adverse effects from the vaccines are quite rare. And as we already discussed, the mRNA cannot alter your cell genome, as it cannot enter the nuclei of your cells where all the DNAs are kept. COVID vaccines and the heart. So research showed that COVID-19 damages the heart. High-risk patients are more likely to face significant adverse outcomes from COVID-19 if they contract it. Causes of myocarditis and pericarditis as side effects from mRNA vaccines are extremely rare. The chance of catching the Delta variant and being seriously ill due to COVID-19 is much higher than having a side effect from the vaccines. Cases of myocarditis and pericarditis are rare, but if they do happen, it's usually in younger individuals after the second shot and within several days of the vaccination. And cardiac issues in a larger time frame post-vaccines are unlikely to be related to the vaccines as well. So COVID-19, again, is an infectious respiratory disease or illness. Proper measures like social distancing, limiting social activities, getting the vaccines, and wearing proper PPE can reduce the transmission of the disease. And just to show you how more contagious each variant has been getting. And just again to show you again that the vaccines, you do end up taking more vaccines and more medications if you do not vaccinate. So if you are against a lot of like medicine, a lot of drugs, then we recommend you get the vaccine, because along down the line you may end up in the hospital where you will have to have more medications, more vaccines, more needles.
If you just go back one slide again, this is actually one more slide. This is called the doubling rate. So one person will infect 2 to 6, 2.5 people, or 3 people, 4 to 5 people, 5 to 8 people. That's just sort of the estimation or the calculation that what we learned is that you can actually predict when the disease will double. So if you have COVID, the original Wuhan version, you infected 2.5 people. The Delta strain, you infect about 5 to 8 people. So that just tells you how contagious the disease is. And because the part about the disease is that you're most contagious before you have symptoms or just at the start of symptoms. And so, accidentally you'll make people sick. I'll give you an example that I know quite well, which is kind of sad. There was a nursing home in that took place where a healthcare provider went into the nursing home, didn't know they had COVID. They were asymptomatic and infected a lot of people, and 4 people in that nursing home died. It only took that person 2 hours of her working time, his working time, before they discovered the person had COVID by doing one of those rapid testing. And so, is that you think you might be sick or anyway or exposed to COVID, please test. The antigen test is readily available. It just doesn't tell you if you have COVID or not, it just tells if you're really producing antigen and you're a higher infectious rate right now. So it's a plea is that I had a cold last week. I thought I had allergies, but I tested myself. I don't have COVID, so I don't want to spread the disease to anybody. So at home we had some family members that were sick. So I didn't go home at times. I just sort of stayed in my office. I isolated myself, and so it's really important to understand that. There's some people I was talking to today, they say, "Oh, I just got a flu." I don't know if you have the flu or cold or virus. We can use some clues on that. The only do is to test. And so please test yourself.
Yes, I think testing is important. Again, just to
Go backtrack. What's that slide there? Tell me about this slide. What's happening here?
This was taken from our previous webinar. This was to show you how serious it can get and the strain that it can have on our hospitals and frontline workers of that vaccination. It's a little less now, but when there are a lot of ICU admissions, we do have a shortage of healthcare workers and supplies, and it can cause a lot of strain on our current healthcare system. And you don't want to end up in one of these beds. So we recommend you get vaccinated.
Now, a couple of things to remember if you just backtrack is that healthcare providers are tired. They worked hard. I'm burnt out. Everybody's burnt out. The whole world is angry, upset, and individual rights. I get it, but a number of people have sacrificed a lot for you. You should thank them. I had the honor of working in a COVID ward for periods of time, and it was a privilege to be there. And I will tell you is that it's scary to be there. It's sad to see bad things happen to people. And I also learned that PPIs really work. When I first went in there, I used to have a beard at one time. I had to shave my beard so I can wear an N95 mask that was properly fitted. So you can protect yourself and you can protect other people as well. And we'll talk about that in a sec over here. And we're privileged that we have really, top of the line healthcare in North America compared to other parts of the world. But we have a limited resource of healthcare and ICU beds, and we've always been at the brink of problems, and it's only gotten worse right now. So the best way to avoid being hospitalized is to protect yourself and to protect other people. And so if you think you might be sick, isolate yourself, test yourself. And I've gotten vaccines for just about everything I can think of in the last couple of months or last couple of years, excuse me. So and that's not by accident that we can do things to help ourselves. Thank you for sharing that. And thank you all the healthcare providers that sacrifice so much.
Yes, just to, I guess, kind of conclude this section of our webinar, we do have previous webinars specifically on COVID-19 vaccinations, more about inoculation and how viruses work. You can also just learn more about COVID spread, what it is, and how you can protect yourself.
So
Now,
if you go back to our YouTube channel, and if you actually, maybe we'll do this a little bit later, if you just put vaccines in general, there's a whole series of webinars. One that Aditi did on, she's now in medical school, on just vaccines in general, very powerful things, just the history of vaccines and vaccines in general, what they can do. I would encourage everybody to take a look at that at some point in time. I looked at it a few times and it brings a tear to my eyes because I think remember polio, the iron lungs and things of that nature. That's the disease that stopped because of vaccinations. And so, and we have so much to learn, but we've learned so much as well. So take a peek at that, just out of interest at some point in time. Go ahead, tell us more.
okay, so now we'll move on to pneumococcal disease. So this is any infection caused by Streptococcus pneumoniae, or a bacteria commonly referred to as pneumococcus. So PD spreads through direct contact, and similar to COVID-19, PD can be carried by an infected but asymptomatic person, which causes it to be spread unknowingly. The disease has a wide range of symptoms depending on where you're infected, ranging anywhere from your ear and sinus to your bloodstreams. Pneumonia is also the most common type of PD infection that you'll see, mainly affecting your respiratory tract. It has a death rate of about 1 in every 20 adults. Other than the lungs, PD can infect and cause inflammation in the bloodstream, the sinus, the lining of the brain and spinal cord, as well as the ear. The respective death risk can be seen here on the screen. Though, as mentioned, symptoms are mainly specific to the site of infection, some general symptoms of PD can be seen on the slide, and it includes things like headache, stiff neck, difficulty breathing, fever or chills, confusion, cough, chest pains, and more. Now I'll talk about some risk factors that can affect your chances of getting an infection. So you can see some of the risk factors organized into 3 main categories, which is age, medical condition, and lifestyle factors. So underage children under 2 and those over 65 are at a higher risk due to their underdeveloped or declining immune systems. Under medical conditions, so those with general pre-existing immune deficiencies or conditions within sites of infections are at high risk. This can include sickle cell disease, chronic heart, lung, or kidney disorders, and cochlear implants, as well as diabetes. For lifestyles, things like smoking and drinking alcohol have a large effect in increasing your risk.
So that's a recurrent theme. You can see the risk factors. You can see is don't get older and take care of yourself and don't have chronic diseases. But easier said than done. And if you do have chronic diseases, do something to treat them. And this is a bacteria infection. This is that. Now, if you just backtrack one slide, this is something kind of interesting, is that we actually have given Prevnar vaccines to young kids. So when I grew up, there was no vaccines for pneumococcal pneumonia or otitis media. We had lots of, I had my tonsils taken out, a lot of ear infections growing up and things of that nature as well. And that was caused by pneumococcal strep pneumococcus, and basically it stays in your nose and it infects others. So what happened is that young children would get otitis or ear infections, would get tonsillitis. I had my tonsils taken out, but the other thing that would happen was a reservoir that when you go see grandpa or grandma, you infect them and they get pneumonia and can pass away. So this disease of, we don't have to put tubes into people's ears. We don't have to take tonsils anymore because pneumococcal pneumonia is being basically taken care of in youths. It's the older generation like myself that are at risk for pneumococcal pneumonia. As you mentioned, at the age of 50 to 60, your immune system starts to fall apart. And basically last year, I got Prevnar 13 to protect myself against severe pneumococcal disease as well. So I hope you consider that as well. And we believe that if you're vaccinated young in life and we have a strong immune system, that might be lifelong. That's what it looks like. But we're going to learn about that as time goes on. And the vaccine doesn't work as well as you get older and your immune system wavers. So somewhere at the age of 50 years of age, or if you have some of these medical conditions on the next slide, like you're a smoker, you have COPD, you have asthma, you have HIV, you should get vaccinated earlier. And of course is that you can be healthier by watching your diet, reducing or stopping smoking and alcohol consumption. If you can't stop, slow down.
Okay, and just to briefly go in depth about the last two risk factors, medical conditions and lifestyle, we'll first look at PD and diabetes. So a study done in 2005 found that both type 1 and type 2 diabetes patients had an average an increased risk by around 1.42 times for a lower respiratory tract infection, which includes the trachea and the lungs. And the exact mechanism by which how this happened is still not exactly clear, but other studies have found an association between increased blood sugar and impaired immune system, leading to slower response times. In terms of PD and cardiotoxicity, PD has been associated with impairing cardiac function and contractility, which is your heart's ability to pump. So a study done in 2014 found several small cuts called microlesions in the heart of patients with PD, which were filled with pneumococcus bacteria, and that led to development of scar tissue, which then impacts your, again, contractility of the heart. It also damages heart muscle cells, so bacteria release substance that forms small holes on the cell surface, and that causes leaking in the important regulators of the heart contraction, such as calcium ion channels. It can also kill heart muscle cells, period, by releasing substance that make the cell burst open in a process called lysis, which leads to the spread of more bacteria. In terms of lifestyles, a study found that smoking was an independent risk factor for PD. There was around 51% increase for cigarette smoking and 70% increase for passive smoking. And again, the exact mechanism of how this happens is not well known, but they posit that smoking impacts your ability to clear away the mucus layer of your lungs, which then allows more time for the bacteria to colonize and grow within the respiratory tract. In terms of treatment, so we do have a previous webinar that goes more in depth about the PD vaccines, but they can be treated using simple antibiotics, but it's important to note that reinfection is possible. There are two types of antibiotics that can be used, specific and broad. Specific only targets the pneumococcus, whereas broad targets common bacterial processes generally. Specific antibiotics are harder to create and generally more expensive because they only target one form of bacteria, but they are becoming more prevalent with the increase of antibiotic resistance. And antibiotic resistance occurs when a bacterial population evolves a mechanism that can either outsmart an antibiotic. Bacteria that can possess this characteristic then can pass on this trait to their offsprings as well as their neighboring cells, which then leads to a rapid spread of resistance. Some bacteria can also acquire resistance through multiple drugs, making them all the more powerful. Currently, 3 out of 10 cases of PD are found to be antibiotic resistance. So what can we do about this? Well, prevention is probably the best option here. So there are 2 main kinds of vaccines. There's the conjugate vaccines and the polysaccharide vaccines. They're essentially the same thing, except the conjugate vaccine just has another protein attached to the processed form of the bacterial components. So common names you might hear about conjugate vaccines include Prevnar 13, Prevnar 20, as well as Prevnar 15. I believe 13 is the older one, and then more recently 15 and 20 came out. The number here just indicates the number of strains the vaccine protects against. Prevnar 20 is currently recommended for those who are over the ages of 50 and 60, and it was approved in Canada, I think, earlier this year in the summer. OHIP currently doesn't cover it, but it can be purchased individually for seniors who are 65 years old or older, but it's free for those who are evaluated as high risk for PD. And getting at least one shot can protect against 8 out of 10 babies and 3 in 4 seniors with invasive PD. I think the cost for Prevnar 13 at the moment without insurance, although insurance could cover most of the cost, like private insurance, it's around $130. I think Prevnar 20, I got mixed results. One of the results told me it was $330 per 0.5 milliliters of a suspension pre-filled syringe. But again, with insurance, the cost will go down. In terms of, and also I think it might be important to note here that the National Advisory Committee on Immunizations in Canada haven't yet deliberated on the use of Prevnar 15 and 20, but they have been approved for use in Canada earlier this year by the FDA and Health Canada. In terms of polysaccharide vaccines, there's the one very common one, Pneumovax 23. It's recommended generally for older adults or those with increased risk, and OHIP does fund this. It's free for seniors who are 65 years or older, and getting at least one shot protects 6.5 out of 10 adults from invasive PD.
So it's so go ahead. I'll get my conclusion in a second. Go ahead.
Okay, so who should get vaccinated? It's recommended for children who are younger than 5 and older adults. Again, because these are people who are at the highest risk group. If you're between ages 6 and 19, it's recommended if you're at an increased risk. If you're between 19 and 64, it depends on your age, pre-existing condition, lifestyle habits, how many and which vaccines you received. And the charts and the images detail the vaccines you need given your particular circumstance. So these are, there's one more graph as well that you can look at to determine whether or not you're recommended to get the Prevnar vaccine. Did you want to add anything, Dr. Curnew?
I think you summarized it very nicely. So basically, the polysaccharide vaccines aren't really as good as the ones that have the conjugate that give you a boost your immune system. And so the ones I would consider right now is Prevnar 15 or 20. Obviously, Prevnar 20 seems to have the most serotypes that are covered. So that's the type I get. And right now that's what we should be aiming for. We'll see what the review committee comes out right now. So the whole point of vaccines is that we have a recurrent theme here is that we learned that influenza, COVID, and pneumococcal pneumonia damage your blood vessels, damage your heart, damage different parts of your body, and that the best way to treat them is to prevent them. They can be fatal diseases, but they're also damage your heart. We have randomized data showing that people who get influenza vaccines have less heart attacks, less total mortality. So to me is that the theme is that all the risk factors from smoking, blood pressure, diabetes, older, cancer patients, kidney failure patients, they're all at higher risk for complications from any infection. And so to me this is actually very much a very powerful way of being healthier. So look at the role of vaccines and obviously talk to your healthcare provider and but do proper and good research. So it's pretty exciting what we can do with vaccines. It makes a difference. And what I learned over the last little while is that we've undervalued vaccines as a society.
And now to move on, we'll talk about common cold. So common cold is a viral infection of the upper respiratory tract, which includes your nose, mouth, and throat. And it can be caused by a number of viruses, the most common being the rhinovirus. And the general symptoms include things that you see here on the slide. They're very similar to the flu, but the difference between the flu and the cold is that the flu is only caused by the influenza virus, whereas a cold can be caused by any number of viruses. This also means that there is no vaccine for the common cold, but they do share, again, similar symptoms, but generally a cold is less extreme than the flu. Some risk factors for complications. So age is one of them. Young children and older adults who generally have a weaker immune system are prone to infections, but children especially are at risk simply due to their exposure in daycare or school settings. The exposure here translates to their family members. For example, if you're often in lots of crowded settings, or if you live with a big family, then a lot of people go to different places and they can bring home the infection, and which puts you at a higher risk for a common cold. Time of the year, it's more common in the winter months. Smoking as well, you're more likely to catch a cold if you smoke or if you're exposed to secondhand smoking. And the reason being is similar to the one mentioned for PD. Smoking negatively impacts your immune system to clear out mucus in your lungs, which then leads to easier decolonization of viruses. In terms of medical conditions, if you have like asthma, ear infections, sinusitis, or other conditions that affect your upper respiratory tract, catching a cold may worsen your symptoms. A common cold can also have a large impact on your heart health as well. A study which looked at the effect of adenoviruses, which are the viruses known to cause cold symptoms on heart health. They found that the virus invaded gap junctions, which are important channel in the heart, used to coordinate muscle contractions. Basically, these viruses close these important channels off altogether, causing arrhythmia, which are irregular heartbeats. So, given the possible detrimental effects of catching a cold, what are possible treatments? So unfortunately, there is no treatment available for a common cold. The best you can do is rest and wait until your body clears the infection. They are self-resolving in about 10 days. You can take other medications that will leave your cold symptoms, such as like Dayquil, for example. But again, studies have found that medications such as Advil, uh, and other non-steroidal anti-inflammatory drugs have shown to increase fluid retention, increasing your risk of heart failure. As well, decongestions have been linked to increasing blood pressures, as well as interfering with other heart medications. So again, taking decongestions can temporarily ease congestion, but it can also create slight increase in your blood pressure. And so if you already have high blood pressure and it's not very well controlled, this may be of concern. You can have also something called rebound rhinitis, which is when you use non-prescription decongestion nasal sprays for more than 3 to 4 days. It can lead to even worsening of these nasal congestion symptoms when the decongestion wears off, and this is called rebound rhinitis. So what should you do? When do you see a doctor? So if your symptoms worsen, then you're recommended to see a doctor. In terms of fevers for adults, if it's greater than 38.5 degrees Celsius, then you should go. For children, it's greater than 38 degrees. If you have shortness of breath or wheezing that's continuous or severe headaches, you're also recommended to see a doctor. So what are some home remedies that you could do? Drink plenty of water and warm liquids to help soothe and loosen the congestion. Rest, stay at home if you can, reduce stress and avoid contact with others to prevent the spread. You can also adjust room temperatures and humidity to keep the air warm and moist. Try saline nasal sprays or drops for congestion, and keep the nasal passage moist and loosen the mucus. So how do respiratory viruses transmit? So we just discussed 4 of them, or 4 types of respiratory infections. How do these viruses spread in the first place? Okay, so the simple explanation is that the respiratory viruses transmit when the virus is released from the respiratory tract of an infector and is transferred through the environment to infect your respiratory tract, which includes the nose, throat, airways, lungs of an exposed person. Some modes of transmission. So there are different routes, or in the literature called modes, and this is how this can occur. The 4 modes of transmissions are direct contact, which is a physical contact between an infector and an infectee. Indirect contact with the contaminated surface or objects like clothes, these are called fomites. There's also, again, direct contact as mentioned before, and also fine respiratory aerosols, which are fine and smaller, which can generally travel further. Here are some 4 major. Again, this is to review the 4 major modes of transmission. So an infected individual here is shown in red, and they can shed virus and droplets coming from their breath by talking, sneezing, coughing, laughing, and aerosols. As you can see, when they contaminate their skin or clothes surrounding objects and surfaces, they create fomites, and you can see here on the left and right. And if the infectee is close, this is called short-range transmission. The infectee can then breathe in the droplets or aerosols through direct contact or get exposed to physical contact with objects, and then touching their eyes, mouth, and nose. On the right, if the infectee at a distance, then long-range transmission occurs, and the infectee can breathe in aerosols or through, again, contact with fomites. It's important to note that droplets are considered more relevant to short-range transmission. as due to their size, it's easier for them to fall to the ground or stay in the air for less time. As you can see in this diagram, for long-range transmission, aerosols are viewed as more relevant. However, it's important to also note that what defines a droplet or the threshold for what's considered droplet versus an aerosol is still up for active discussion according to this review published in August of last year. Okay, and now on to the viral, environmental, and host determinants. So the behavior of these particles are influenced by environmental factors such as composition, temperature, humidity, and airflow. Thus, larger droplets can be propelled further than expected based on a prediction based on just a particle size. Recently, there's been more concern for aerosol transmission. Bioaerosols can remain in the air for a prolonged period and also travel for long distances due to their size. This often requires additional safety measures like larger spatial separation between hospital beds. Starting off with viral factors. So transmission is determined by virus stability under environmental stress, which is then influenced by the composition and structure of the virus. This also affects how good the virus is at replicating itself. Its defense against host cell defense mechanisms determines the site of infection and the affinity and specificity in which the virus binds with specific host receptors, which serve as a gatekeeper to the host cell. Moving on, the main structural components of a virus are the envelope, which contains the surface proteins that bind to the host cell receptors, the capsid, which is like a protein shell, which confers the stability of the virus, and there are the internal protein viral genomes, which again confer stability and determine the speed and efficiency of replication. The viral genome specifically can also determine how well viruses can adapt to the host to replicate or enter host cells more efficiently. Environmental determinants of virus survival and transmission also affect transmission by influencing the survival and persistence of respiratory viruses in droplets or fomites, or influencing the host like viral shedding or their human behavior. As you can see on the screen, the various determinants are temperature, humidity, pH, ventilation, and airflow, salinity, surface materials, and UV radiation. Factors such as pH, and UV radiation temperature can break the viruses down so that they can no longer infect another person. However, the way these factors modulate transmission is different for every virus. Here are some host determinant factors as well. So tissue and cellular tropism. So tropism refers to how your body might respond to specific stimulus, in this case, a virus, determines the site of release of virus. For example, SARS-CoV-2 replicates solely in the alveolar epithelium. However, the SARS-CoV can replicate in both bronchial and alveolar epitheliums, which is like the lining, which could potentially explain how SARS-CoV-2 is more efficient at transmitting. Lung function can also impact the number of particles and the size distribution. Furthermore, its anatomy can also affect where the virus particles deposits in your lungs. If the host has had previous immunity from a prior infection or vaccination, that can also affect viral shedding. Furthermore, host-dependent factors like the number of target receptors in a specific tissue can also affect the size and risk of infection. In general, host genetics do influence the severity of disease upon infection, but less is known about its impact on transmission. Furthermore, at a population level, social contact patterns affect the mode of transmissions as well. So here, just to summarize here again, viral transmission is complicated and multifaceted. One model of transmission does not apply to all respiratory viruses. The four major modes of transmission are direct, indirect, droplets, and aerosols. The relative contributions of each separately or in tandem to transmission per virus is something we still have to explore as well. Additionally, there are several other factors which can modulate transmission. Some are related to the virus and the host itself, but also the environment too. And depending on the virus, the way these factors can modulate the spread is also very different. Okay, and now I will pass it on to, I believe, Jaden on how do vaccines work.
Perfect. Awesome work, Suvan. So now that we've had the pleasure of learning about vaccines and viral, environmental, and host determinants, let's talk about how vaccines actually work. And of course, Dr. Curnew, if you have any observations, please feel free to interrupt. And so to explain how vaccines work, we wanted to get a little bit more creative. So pretend you were going into a story reading about an upcoming movie about vaccines. And these are a few key features within the movie that should draw your attention. So where does our story take place? Our story takes place within our immune system. And the immune system is a complex network of cells and molecules, and essentially a city, of course, within our body. And there are two parts that I want to highlight within our immune system. We have the adaptive system that's specialized, and also the innate system that is generalized. And the goal of our immune system is to protect us against pathogens. Moving forward, we have our protagonist of the story. And so our hero in this case are our vaccines. And there are different forms of vaccines. We have live attenuated vaccines, subunit vaccines, and messenger RNA vaccines or mRNA vaccines. And the goal of our hero is to train the immune system to detect and attack pathogens. There are various routes of administration for vaccines. We have the oral route, we have intranasal route, the subcutaneous route, and the intramuscular route. A fun fact is McMaster, a university in Hamilton, has been doing some research on intranasal routes for COVID vaccines. And so that's one consideration to, just think about. For our antagonist of the story, we have our pathogens, and our pathogens are the villains. These consist of bacteria, viruses, and they can be identified by antigens. And antigens are found on these pathogens, and once we detect antigens, we can furthermore destroy the pathogen, and they can be destroyed via antibodies and phagocytes. And let's look at our supporting characters. So these characters are all found within and part of the adaptive immune system. We have the helper T cell, the B cell, killer T cell, and dendritic cells. And the goal for these characters are to activate and train or are to be activated. In doing so, will create immunity for the immune system. Some additional calls with bodies and also memory cells. So a question that remains is, why do we need vaccines? And so this is a graph of the immune system. And when initially exposed to the pathogen, there is a lag phase. And because it takes time for our bodies to be able to produce antibodies, both the innate and intrinsic defenses fight off pathogens. It takes around 4 to 9 days for the adaptive system to kick in with antibody production. And so this is a quote that we want. Oh, perfect. The idea of herd immunity. So even if not everyone gets a vaccine, if there is no host, right, for the vaccines, then the pathogens or the viral virus it reaches enough people and when immunity reaches enough people within a population who have recovered from the disease and have developed protective antibodies against future infections, this prevents the spread of the disease. And this emphasizes the importance of getting vaccines, not only for yourself, but for others within the community. And so looking at our quote right here, we know that a good doctor treats a disease, but a better doctor prevents the disease. And so one thing to take away is that vaccines prevent diseases or severe diseases. And by getting a vaccine, it provides protection for the future by priming your immune system to respond to certain infectious diseases. And to address vaccine hesitancy, it has unfortunately become a more prevalent issue, especially with social media and all these forms of communication. And vaccines have always played an integral role in providing us with immunity and reducing the load of serious diseases such as measles, mumps, rubella, polio. And if you are uncertain about getting a vaccine, you will want to check out more of our videos found on the YouTube channel to learn more or have a discussion with us. And if someone you are concerned about is thinking or is concerned about getting a vaccine, Number one, you want to listen to the concerns and questions they may have. Number two, explain the facts that you know. And they include vaccines are safe and effective. They provide protection, the immunity component, and COVID vaccines reduce hospitalizations by 90, and side effects are very, very rare. And so again, some key takeaways. We know that vaccines are safe and effective. Vaccines work by providing a signal to your immune system to build antibodies against a specific disease. Memory B cells can retain a amount of response to an infection so that in the future, the likelihood of another infection is diminished. And vaccines are required in both childhood and adulthood. And so you can assess your records through the Public Health Ontario. COVID-19 vaccines are based on decades of research and reduces hospitalizations due to COVID by 90%. And so that is quite a startling statistics. Any vaccine you can get for COVID is the vaccine to get. And finally, vaccines also have protective effects on the heart by preventing access to disease.
Okay, great. Thanks, Jaden. So we're going to be moving on to our little final portion of our presentation, and we're going to be discussing about the effectiveness of masks and face guards. So masks and face guards has become sort of like a symbolic representation of our suffering through the COVID-19 pandemic. We were mandated to wear masks, and we also had to social distance to prevent the spread of COVID-19. So previous studies regarding the effectiveness of masks are usually studied from the perspective of a virus carrier wearing a mask to contain the spreading of the virus. So what about from the perspective of a susceptible person wearing a mask for protection from the airborne sneeze, cough droplets, or droplet nuclei? And also considering that we are gradually going back to our normal daily lives, we would engage in close face-to-face interactions with others. So how would that change the effectiveness of the masks? So to answer this, a study was conducted that tested 5 different masks to observe how much each face mask offers protections from airborne sneeze or cough drops in close-up face-to-face human interactions. So to replicate this situation, the following parameters were met for the research. So number one being that it occurs in close range, under 6 foot, and also the size of the droplets is really important. They were 1 micrometer because this was the most prone to be airborne and thereby traveling with moving air to a person nearby. So the image on the right just illustrates whereby you can see the floating remains of the airborne particles for an extensive period of time, even after the immediate cough or sneeze that occurs. So following this, we're going to look at the results. 5 different masks were tested, from N95 mask, surgical mask, cloth mask with PM2.5. PM2.5 means particulate matter 2.5. So this filter was created to screen any particles that were any particles up to 2.5 micrometers. And then we have the cloth mask, and we also have the wetted cloth mask with, again, the PM filter of 2.5. And the effectiveness of each of these masks were measured using the escape percentage. So this is essentially the percentage of droplets from a sneeze or cough that escape or travel through the mask material into you. So the greater the number, the greater the percentage. This poses to show that there are more particles entering into the mask. So we could see through the results that N95 resulted in 0%. There were no particles going through the material. And then it was followed by the wetted cloth, PM2.5, the surgical mask, and then the cloth particle mask with 2.5, and lastly, just a regular cloth mask. So just looking at these numbers, there is a certain degree of leakage percentage of the airborne droplets mask, and it does not offer a complete protection for a susceptible person from a viral infection in close face-to-face interactions. But does that mean that there's no point in wearing a mask? It's not. So it's really important to note that masking reduces the dosage of virus that a wearer might receive. So if we move on to the next slide, and this results in infections that are milder or even asymptomatic. So a larger viral dose means that you would have more aggressive inflammatory response. So although the effectiveness of the masks differ based on the different types, they all contribute to lowering the number of particles getting into our respiratory tract, and with lower viral doses, we would experience less severe symptoms. So based on this, there was a California case control study that was conducted to look into the effectiveness of face masks in indoor public settings. So as we can see in this diagram here, wearing a mask lowered the odds of testing positive in getting COVID. So as you can see, again, we said that respirator, the N95 had the most the effectiveness, hence resulting in the highest lower odds, followed by the surgical mask and the cloth mask. So although these research has been done in terms of COVID, it's also important to note that influenza, common cold, these are all also airborne diseases or illnesses. So wearing a mask is important for those who are susceptible to respiratory related diseases or someone who might be immunocompromised, but even more so for people, just any people, to prevent the spread of COVID-19 as well. So moving on, and other than just wearing a mask, there's other ways to keep yourself safe. Number one,
Let's just backtrack one more slide. I think it's beautiful. So basically is one, I think you said it really nicely. You decrease the amount of virus that you will put out by wearing masking. So to me is that if you're in a very high risk situation, let's say you're going on a plane ride, and you're worried about in a plane how many people have COVID or whatever, the best thing to do is to wear an N95 mask that's been properly fitted. So if you have a beard and things of that nature, I had the luxury of getting fitted, and basically I had to shave off my beard. And so you need to have a proper seal. So wearing a mask like this doesn't do any good. And, you know, pinching your own nose, and a surgical 2 or 3 layer mask is something that you should have some. Cloth masks aren't as nearly as effective. So to me is that I would get some surgical grade masks. They're readily available. And I would see if you can get a N95 mask. And I don't know how the average person gets properly fitted or whatever, but those are better masks. And, you know, is that the reasons that, you know, I see so many people wear their mask like this, don't cover their nose, wear it properly. And it's really an insult to people to come into my office who I treat high-risk patients and not wear a mask properly while you're in the office. I understand it's not easy, it's not fun, but is that there's a lot of RSV out there, there's a lot of common cold, there's a lot of influenza, there's a lot of COVID around. They're all infectious, they all damage the insides of your body, and we don't want to infect other people, and we don't want to affect others as well. So I think it's important that right now, this is a time where, you know, people are arguing about mask mandates or not. I understand that people feel it's an impingement on their rights. I get that. It is an impingement on your right, but it's also to protect you and other people as well. So, and if you're in a high-risk situation, wear a mask. It, you know, it makes a difference. So I think, thank you for showing that. That's actually important.
Yep. Okay, so yeah, other than masks, there's also other ways that you can keep yourself safe. Number one is safe distancing. It's not just for COVID, but if you're particularly susceptible or vulnerable, you should practice safe distancing so that you could help to avoid people that might be sick. And yeah, so number one would be safe distancing. Number two is simply washing your hands, just taking the time, using a soap, taking about 20 seconds to thoroughly wash your hands is also important. And number three would be avoid touching your body. So such as rubbing your eyes, your nose, and your mouth, especially with unwashed hands, as it would make you susceptible to infection. And number four is using something called a HEPA filter. So HEPA filter stands for high efficiency particulate air filters. So if you go on to the next slide, we could see an image of it. So these filters are usually found in HVAC systems, but usually they are also, now they create portable HEPA filtered air filters. So basically what they do is they remove dusts, pollen, mold, bacteria, and other particles in the air. And these are all equipped with HEPA filters that help to remove particles up to the size of 0.3 micrometers with a minimum efficiency of 99.97%. So there's other types of filters as well, such as MERV. There's some technologies involving ultraviolet or ion generations and other technologies that help to remove particles as well. However, because these technologies may pose health hazards to building occupants, and they also add very little added benefit to air cleaning. So we usually recommend HEPA filters, which solely relies on mechanical filtration alone to remove the particles. And because they already have a high efficiency of 99.97%, these are usually deemed enough. So also another second thing to note is there's something called the CADR rating. And essentially what this is that it rates the air cleaner performance. So a higher number means that it filtrates more particles and it covers a large area. So if you are considering buying one of the air filters, these are the two elements that you would have to look into to see if you are buying the appropriate air filter for your room, your location, wherever that might be. And if you do also buy one, doing proper maintenance of these air filters is really important. You have to consistently replace the filters so that it could actually do its job properly. So the next thing would be boosting your immune system. This is more of a natural way that you could strain your immune system to become more resilient to viruses and diseases and etc. So number one would be simply staying active and maintaining a healthy weight. So we mentioned this before, but just trying to remain in that BMI of 20 to 25 usually is considered to be a healthy weight. Number two is a well-balanced diet. There's usually nutrients and vitamins, minerals involved that also help you to sustain or strain your immune system. Resting well, sleeping well, and lastly, avoiding to smoke or drinking alcohol can also help with your immune system. And lastly, we're just going to do one busting myth on vitamins. So there's a popular notion whereby a lot of people think that taking vitamins usually help to boost your immune system. However, this can be very misleading. It's true that vitamins are essential elements in the body to maintain a healthy immune system. However, megadoses or excessive consumptions of these vitamins can actually rather lead to adverse effects. Therefore, it's not about boosting your immune system. Rather, what we want to do is focus on ensuring that we're not deficient in any of these vitamins or minerals that are important. So all vitamins that we know of, like A, B, C, D, E, and so on, they're all very important to the immune system, but there's three that I'd like to specifically mention. It's vitamin C, D, and vitamin B12. So vitamin C, it's very much known. They're vital for the health of leukocytes, which are white blood cells, which is integral to our immunity. And unfortunately, our body cannot make vitamin C, so we have to get it through external sources. Usually, fruits and vegetables should be enough for you to meet the recommended daily amount. As for vitamin D, it's the vitamin that we get or we create from the exposure to the sun. And interestingly, this is one of the most common deficient vitamins that we find in a lot of people. So it depends on the person, but supplements are sometimes recommended. The recommended daily amount being 600 international unit. And again, excess consumption, especially for vitamin D, it can cause hypercalcemia, which is calcium buildup. It could also cause nausea or vomiting. And lastly, I want to mention vitamin B12 as well, because vitamin B12 is only found in meat and animal sources and are not evidently found in vegetable or plants. So nowadays, where a lot of people are shifting towards a vegan or a vegetarian diet, they can be a lot more prone to this vitamin B12 deficiency. And lack of this vitamin B12 often leads to anemia or damage to the neuronal health. So if you do follow the vegan or the vegetarian diet, it's strongly recommended that you look for vitamin B12 fortified food, supplements, and ensure you have a well-balanced diet.
Okay, so just to summarize again, today we talked about like the four major respiratory infections. We talked about how they spread, vaccines, as well as other ways to keep yourself safe. Dr. Curnew, would you like to speak on the Can Immunize app to summarize?
Yeah. I think one of the things is that, so thank you for the presentation today. So we learned that infection can be airborne ways. Yes, we can pick up particles by touching, but a lot of these diseases are transmitted by respiratory pathways, so aerosols. One of the things that I think we haven't really spent enough time is looking at proper ventilation. I'll remind people that you're 35 times less likely to catch COVID outside compared to inside. So I was at a wedding this fall with an open barn with just a roof, but there was no walls, and so that felt a little bit cooler, but it less chance of transmission. And whether groups of people will gather, you have to decide what type of masking procedure is appropriate for you and other people as well. You mask to protect yourself, but more importantly, you mask to protect others that are more vulnerable, as we talked about. We learned that all different type of infection from influenza, pneumococcal pneumonia, COVID damage your insides, your respiratory system, but also damage your vascular system as well. And we're still learning about that. We know that people who get infections, even gain shingles infections, are more likely to have a heart attack. The risk is short term for sure, and how long that risk carries long term, we're still learning about this. If you're not sure if you're infected, we have rapid testing for COVID, so get it done. We don't have rapid testing for everything at this point in time. And to me, this Canada Immune app is something I started to use, and I need to update that better. Is that I can't remember all the vaccines that I got and when to get them, so you can actually look for recommendations. Number one, and number two, you can store that information. So all I can tell you, during this COVID pandemic the last couple of years, I got my 2 shingle shot. I get influenza every year. I get COVID vaccines every 6 months. I got Prevnar 13 last year. And my tetanus is up to date, and I've been vaccinating against hepatitis B many years ago. We tend to vaccinate young kids well, but we forget older individuals' vaccination, so we should think about that. And I think you point out is that a better way to treat illness is to prevent illness, and vaccines are part of that. They don't always eliminate illness; they actually decrease severity of illness, and so that's actually important. I want to thank the group for sharing that information, and I hope people think about this a little bit more. Any thoughts from anybody? Daniel, what are your thoughts?
I mean, I think Dr. Curnew, I think this was a very well-timed webinar, considering, as we've all sort of talked about, flu cases are rising. COVID's been a thing for the past 2.5 years. I think it's very, very well timed. And in fact, actually, I'm getting my flu shot this weekend. I should have gotten it a while ago, but like, it's been just one thing after another, but I'm finally getting out there and doing my due diligence. I wanted to know, Dr. Curnew, for the patients who are watching this this webinar, do we still offer, or does the pharmacy downstairs, the shoppers they're still doing like flu shots and all that such, right?
So right now you can actually come down to Shoppers if you Rami and his staff are wonderful people. They spend a lot of time vaccinating. You can say that you're a patient of ours, so you don't have to be a patient of ours, they'll vaccinate you anyways. And just say, for instance, you can get the flu shot and COVID at the same time. And there's actually data that if you have a reaction to it, you get that redness, that soreness, that means your immune system is working. You might actually have a better response to someone who has no symptoms whatsoever. So please consider that as part of your health maintenance package. I think it's something that the best way to treat is to prevent, and it works. And we have wonderful scientific data. Yes, there are things that can go wrong, but there's a lot of misinformation out there, and that we're learning all the time. So I thank the team for putting this together. I wish people a happy vaccination season, and there's other diseases to think about. And last year, and again, is that I had a chance to look at inflammation causes atherosclerosis, damages, and one way to cause inflammation is through infection, and it's important to decrease that severity. We can't wipe out disease, but we can make it less susceptible. And I thank you for always remember that exercise, weight loss, good sleep. And one of the things I didn't realize that till recently, that alcohol weakens your body's ability to fight inflammation. So every little bit counts. And if you're going to rely on supplements like vitamin C or vitamin D, I think you got a lousy insurance policy. So you're helping somebody. It's usually the person who sold you those products. And if you want to help yourself, look at stuff that's based on science and test yourself.
Oh, can you guys still hear me?
Mm-hmm.
Okay, I think maybe Dr. Curnew cut out on his end. I don't know, he's frozen for me. Is he frozen for you guys as well?
Yeah.
I see. I guess, did you guys have any other slides that you wanted to talk about after this?
No, this was everything.
This was
Just
the
like,
last one? Yeah. Oh, one thing to add as well. It's not on the slide, but I'll say it verbally. If you guys have any questions, feel free to email us at drcurnew232@gmail.com. We'll put that in the description as well. It's drcurnew232@gmail.com. Yeah. But I guess we hope you guys have a great evening, and we'll see you all soon, okay?
Good night, everybody.
Night, everyone.